Welcome to Texas A&M AgriLife Extension, Hidalgo County. My name is Joanne. I'm one of the Family and Community Health County City Agent for Texas A&M AgriLife Extension, Hidalgo County. Today we're going to be doing a walk and talk. What it means is I'll be presenting and you will be walking. The purpose of this talk is to inform you about warning signs of a stroke. Alright, let's get started. Start walking. Let me tell you a story about Jill. Here he goes. "It's Jill. I need help," she cried on the phone. She recalls that she couldn't speak or understand language at all. On the morning of December 10th, 1996, in the course of 4 hours, a stroke robbed Dr. Taylor of her ability to walk, talk, read, or recall any of her life. On that day, she became an infant in a woman's body. Dr. Taylor was a brain scientist at the Harvard Department of Psychiatry. On the morning of the stroke, she was getting ready to go to work as usual. She had a throbbing headache, but she ignored it. However, she was surprised when her walking became wearisome and speaking became slurred. As her right arm fell limp and balance wavered, she knew it had to be a stroke. She immediately reached out for help. However, it took her more than 5 minutes to even punch in the phone number because she had to use her left hand and her memory was fading. "But I am a very busy woman. I don't have time for a stroke," was one of her last thoughts before she lost consciousness. The emotional and physical cost of her life was tremendous. It took nearly 8 years for her to recover her normal mental and physical ability. However, she is among the fortunate few. She is alive only because she was able to recognize the warning signs of a stroke just in time. Dr. Taylor is the author of a New York Times best-selling memoir, My Stroke of Insights, which she describes what she saw through the eyes of the brain scientist who had the opportunity to lose her mind. Her not-for-profit organization called BRAINS, BRAINS, is dedicated to increasing awareness, education, injury prevention, recovery, and the significance of mental and physical health. Alright. Can you name one warning sign of a stroke? What happens to a person when they have had a stroke? Your brain depends on oxygen-rich blood to perform everyday tasks, arms and leg movement, speech, and many other functions. A stroke occurs when blood vessels feed the brain with oxygen, burst from an injury or damage, which results in one or two types of stroke. The first one is bleeding in the brain. This is when a brain artery ruptures. And the other one is when there's a blockage in the brain. Two common causes of these strokes are high blood pressure and plaque buildup due to a not healthy diet. A stroke causes brain cells to die that may affect a person's ability to move, speak, feel, think, or even recognize people. About 795,000 Americans each year suffer from a recurrent or new stroke. In the United States, stroke is a major cause of serious long-term disability and is the fourth leading cause of death in adults. Every 4 minutes, a person dies of a stroke. On average, a stroke occurs every 40 seconds. The chances of survivors are greater when treatment begins quickly. Patients who arrive in the emergency room within 3 hours of their first symptoms tend to have less disability 3 months after a stroke than those who receive delayed care. High blood pressure, high cholesterol, and smoking are a major factor for a stroke. About half of the Americans, which is 49%, have at least one of these 3 factors. Age and race also plays a role in having a stroke. Strokes are twice as likely to happen in African Americans compared to whites. More than 2/3 of the strokes involve people over the age of 65. Although stroke is common in older adults, it can also affect younger individuals. In 2009, those younger than 65 years accounted for 34% of stroke hospitalization. Women have been shown to negatively impact by stroke, making up to 60% of stroke death. Recent stats show that stroke is the third leading cause of death for women, but the fifth in men. Since 1970s, there has been a remarkable decrease in stroke deaths. One possible reason for the decline in prevention programs aims at reducing strokes risks, such as high blood pressure and cigarette smoking. 80% of the strokes are preventable. Other healthy lifestyle choices to prevent strokes include keeping your cholesterol levels healthy, losing some weight, getting enough physical activity, and limiting alcohol use. In addition to reducing your risk for strokes, it's critical to learn the signs and symptoms of a stroke for survival. You can help save the life of someone who might be having a stroke by learning these fine symptoms of a stroke. For example, sudden numbness or weakness in face, arm, leg, especially on one side of the body, sudden confusion, trouble speaking or difficulty understanding speech, sudden trouble seeing in one or both eyes, sudden trouble walking, dizziness, loss of balance or lack of coordination, and or sudden severe headache with no known cause. Because stroke is a leading killer in the United States, it's important for each of us to know how to recognize the warning signs of FAST. If you think someone is having a stroke, the FAST, F-A-S-T test developed by the National Stroke Association can help you determine if you need to get immediate medical attention. F. Face. Ask the person to smile. Does one side of the face droop? A. Arm. Ask the person to raise both arms. Does one arm drift downwards? S. Speech. Ask the person to repeat a simple phrase. Is their speech slurred or strange? And T. Time. If you observe any of these signs, call 911 immediately. F-A-S-T. You can perform these tests just by observing the person. It's easy and simple, but very critical to save a life. There is a great need to increase awareness of FAST tests, and it can start with you. Having a stroke can happen to anyone. Disabilities from strokes can be financially distressful, not just for you, but for your whole entire family. Healthy living and becoming informed about stroke symptoms can always save life, and possibly your own. Like Dr. Taylor's story, she was able to recognize her own stroke symptoms and took action. She was lucky that the person who took her call knew she was in trouble and sent help. Not all stroke victims are fortunate. Strokes can affect people suddenly or slowly. Imagine what could have happened if Jill hadn't been able to make the call. The FAST test is simple and easy to remember. Knowing the information is practically because you are equipped to handle a possible stroke situation. As we mentioned before, stroke is the fourth leading cause of death. Awareness about FAST, F-A-S-T, test is a way we can all take part to address this problem. There is no cost to you except the time you spent memorizing the 4 signs of stroke and being ready to offer help. Are you ready to act fast? Thank you for walking with me and listening to my Health Talk Express. See you next week.